Dr. Vidya Shenoy, our August speaker. Thank you so much, ma'am, for saying yes for this. And
Thank you.
please, thank you so much to address a very important topic today, Dementia Circle of Awareness, breaking stigma, early diagnosis, care, support, and hope. We all know that we forget this thing or that thing every day, but we don't know what is actually the dementia is, what severity is that, and when we have to seek medical advice, how they should be cared. So all these aspects, thank you so much, ma'am, giving your time and your valuable experience to our audience. Just to formally introduce our August speaker, Dr. Vidya Shenoy. She is an integrative therapist, aging and dementia care specialist, honorable secretary, ARDSI Mumbai chapter, and founder of Smriti Vishwam Universe of Memory, steering committee member, EDSIG Dementia Alliance International, and ambassador of India for Purple Angel UK. Dr. Vidya Shenoy is a passionate advocate for the cause of holistic aging and dementia, and she has founded the daycare centers in Mumbai, as I already named them. Her contributions also include a children's storybook, Remember Those Who Cannot Remember. That's a very beautiful contribution from you, ma'am. She has been bestowed by many awards, including the Lifetime Achievement Award 2025 by Ministry of Social Justice and Empowerment, Government of India. Over to you, Dr. Vidya Shenoy, ma'am, to give your detailed introduction and also the detailed introduction about the topic. So floor is yours. For next 45 minutes, 50 minutes, I request audience to keep your um, speakers on mute so that everyone could hear the valuable guidance and inputs from the ma'am. Whatever questions if you are having, please put that on the chat box. We will take after the session. And we would also have some poll questions we could have if time would permit, uh, to be asked by all the audience from Vidya ma'am. Thank you so much, ma'am. Over to you.
Thank you, Dr. Meghna. It's a privilege for me to address the HSSC session, the 18th session of the awareness series, and it's a wonderful, project you've taken up because there are lots of health issues that concern people, especially the aging population. And with today's position, where every 3 seconds somebody is developing dementia in the world, I think it's time we took it by the horns. And COVID has given us a very, difficult experience where we realize that we are not ready with the healthcare infrastructure and facilities to be given to the general public. So I'm glad today the government is taking it seriously and has come a long way from where we were pre-COVID, and people are getting access to healthcare. So I welcome all the people who've joined in, who've made time to come in and have actually wanted to listen to the topic which I'm going to do on dementia, whether it's awareness, reducing stigma, early diagnosis, risk reduction, and various other things, including hope for the future. So I'll, without wasting time, I'll just share the PPT and go ahead. So this is just an introduction, which, you've already given a brief of, but my commitment is to the, children with special needs as well as adults. And I'm very keen that, we develop a dementia-friendly community and eventually the country where dementia is not treated with social stigma. And we have enough time to let people know that they're valuable, they're alive inside, and we need them more than they need us. They've given their bit to us when we were growing up, but now it's our turn with a role play to be there as adults to, look after the child in them which is now surfacing. So, I begin the presentation with gratitude to the divine within, which is always a thing. Thankfulness comes anyways when you get something. But here I start because today what I am, it's because of the, people who've been surrounding me, or I have been surrounded by people who have encouraged me to do research, to fall back on them for guidance. Various people, those in the background who even I may not know who have inspired me, but they have. People, professionals, researchers, my family with dementia, that is at the Dementia Daycare Center called Smriti Vishwam Universe of Memory. And actually, I say it's my universe. It's my universe within, where I love my family, their families, extended families, and the caregivers who bear the onus of looking after their loved one who is living with dementia. And here itself, may I say that, we are always there to be there for people who need assistance. It's unconditional. Anytime we are there, and if we cannot attend to the call right away, you will definitely get a call back. So here we start. I've already said that, the topic is Dementia Circle of Awareness, breaking stigma, early diagnosis, care, support, and hope. And, this is quite holistic because 1 hour is never enough. But I've tried to take as much, information to share with you, and then we can proceed later on an individual or through other norms. So here we start with the circle of life, and in fact, dementia circle. So we are going to cover the topics that I've just spoken about. And then we start with aging, because aging is an issue that nobody can run away from. It's a natural arc in the circle of life. And we are going to live through, however much we don't accept. We're all aging. Every day we are aging. But how we age is up to us. Whether we stay young at heart and in the body also, that the chronological calendar age doesn't matter. Or we just say, let's have fun when the going's good, and then give up. So we see the current situation. The aging population is growing very, very fast. We see that, the pace is much faster than what it was in the past. And hence, in spite of, knowing what the COVID challenges were, I think today nations all over the world have to look after how they can maintain their health and social systems to look after their people. So what we would do is see how the aging figures affect us. So the demographic shift is creating a lot of challenges. Also, by 2020, which we have already well passed, it has seen that the younger children have been outnumbered by the people over 60 years of age. And by 2050, we will have the world's senior population nearly double from 12% to 22%. Very serious, supposition, unless we actually resolve the issue at the beginning. And when we actually reach 2050, we'll be able to meet the challenge. And the main thing is by 2050, 80% of the older population will be in low and middle income countries. So today we have 703 million elderly people. By 2050, it'll be 1.5 billion. That means from today's 6%, it'll be 17% increase. So we see the map where the graph is showing the figures which are taken from the various research resources. Then we have aging in India. We have, as I said, every 3 seconds, somebody is developing dementia. And the thing is that India has today 8.8 million living with dementia, and 8.5% of elder population of the 104 million are aged. So what we see is there's a vulnerability in the elderly population. It's the second largest globally. In fact, we are slowly creeping towards becoming the largest. The rise is from by 21% to by 2050. The elderly will mostly 30% be in urban areas, and the expectancy is 17.9. That's about 18 years, projected to reach 12 to 14 million, as they say, by 2050. So what are the care costs? Because every health issue has a challenge of care costing, whether it's institutionalized or it's at home. So the urban area, it's anything between from 45,000 to 2 lakhs. Rural, it's 20,000 to 66,000. So these costs, who can bear? How many can bear? Is the government ready with plans for the BPL people? Can they give like facilities like socialized medication, socialized medicine does? Can we afford it? Are we ready? These are the questions we have to ask. So what is the aging process? It's a change from molecular to cellular changes over time. They're variable depending on many factors like the family history, genetic, age. Also, with various health issues, we have capacities decrease. They never increase with aging unless we sustain that capacity. And of course, comorbidities of aging are there. So what are the other factors that affect our aging process? It's the environment we live in, it's the family atmosphere, how secure we are with the family, how closed and loving they are. Also retirement. A person who's been very, very busy suddenly finds them at loose end. Then what happens? They go into a shell. It could be depressing, leading to many other health issues. So that is the reason why we come and we do a lot of programs for the retirement group, so that they can plan their day as like a working day, but they're doing things what they would have wanted to do but could not do because of the work. Another thing is relocating from one place to another. When you're uprooting a plant, it's, it has its, you have to pay a price. Likewise, for human beings, our parents, our elders, when we uproot them, there's a lot of challenge for them emotionally, physically, because they have to adjust to a new place. The fear, will they be safe enough? All these things come to their mind. And when there's a death of a partner, a spouse, or close friends, I think that also disturbs the individual. So these are the challenges of aging. Besides, what happens, which are the domains it affects? So we have physical, mental, change in personality, quality of life, well-being, psychosocial, and of course financial, but that comes when all the comorbidities surface. So we come to the next, like, what is awareness? Awareness is something where we need to know about dementia and how. So we look at awareness with the symptoms point of view. So the 10 symptoms that are recognized by the WHO and ADI, it says recent memory loss that affects job skills. There could be decreased judgment. There could be loss of initiative, forgetfulness in knowing where you've kept certain things, in which place. There's a problem of expression with language, with words. So a person who has, even minimal cognition impairment, MCI, he or she would also have this challenge, but it doesn't mean because this challenge is there, they have dementia. Then, difficulty in performing familiar tasks, daily tasks, activities of daily life. Their abstract thinking increases, their judgment increases, and of course, there are mood swings, loss of initiative, or a very active person who would take the initiative of doing something, or was an extrovert, suddenly gets withdrawn, loses interest. But the most important thing is dementia reflects on change of personality, and that is a thing which, when this happens, we have to immediately seek help. So then we come to what are the other signs of dementia? We've often seen that people with dementia and of course aging, they are very suspicious from somebody coming, a new person coming into the home, or somebody visiting, or a postman changes, is who's this person? There's a lack of trust, a problem with language, making sentences. Like, I had a teacher who taught languages and couldn't find the words. So these are, cases that do happen in dementia. Then we have people going off into, space. They go blank, and, they just don't know where they are. They are withdrawn and probably depressed. And then what happens is when they come out, they're repeating the same thing again and again. And what happens is that when there are children in the house, it tends to be more irritating to them because they've come from school or they're playing with their friends of other siblings, and they're being disturbed by the elderly with dementia saying, have you had food? Have you had food? So these are the other signs. Also, there's fear, a fear of having things change in their life, in their routine. So if you say, okay, let's have breakfast now when they are supposed to be reading the newspaper, they'll get irritated and they say, no, 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 I don't want to do it. Mood swings come up. Sometimes they get violent depending on the stage of dementia they're in. Also, a person who, we have seen often on the road when you're crossing the road or standing there or even parked there, you see an elderly person going back and forth in the same place. There's confusion. They don't know where they are. They cannot navigate themselves into which direction they should go. So all these things could be signs of dementia. And another thing is that they have, since there are breaks in the synapses, there are disconnected thoughts. So if you ask them saying, would you like to have tea? You might get an answer saying, oh, I went for the wedding, blah, blah. So there's no connectivity in the question and the answer because they themselves are mixed up in the mind, and they cannot express themselves correctly for the question asked. And the saddest thing is that aging is, I don't say whether it's a boon or a curse, because aging gives you the wisdom to do what is not, not to do what is shouldn't be done. So I think aging also gives the wealth of experience, wisdom, the a time to do what you want to do, which you could have loved to do, but you couldn't do because of work commitments or other family commitments. And another thing is that there is no time in today's rat race of life where people would like to spend time with the elderly or their family, their children. They cannot because of the busyness at work. So these are the some more signs of dementia. And then we come to is the types of dementia. So there are many types of dementia. I call dementia as a cluster. It's an umbrella with a cluster of symptoms under it. And these symptoms are due to the death of the neurons in the brain, and which are irreversible. You cannot recreate them. So you have to take care that more neurons don't go. Alzheimer's disease is the most common of them, with 60 to 70% of people with dementia having Alzheimer's. That's why there's a lot of confusion when people say, oh, so-and-so's got dementia, so-and-so's, the same person's got Alzheimer's, because they don't know that Alzheimer's is the most common dementia that is found, and that is why they're taken as synonyms. There are other forms like Lewy body, there's mixed, there's frontotemporal. Frontotemporal is where, expression, language, speech, memory recall gets hampered. Then you have Parkinson's related diseases where you know that you can see Parkinson's because there's a tremor in the arm or the limb, and that is there. Then you have other related dementias due to diseases coming under the dementia umbrella. It could also be vascular. Vascular is very common because that's when the blood supply to the brain is lessened, and hence the dementia develops. Then you have, drug related, you have genetic reasons, and you also have infections, dementia created because of infection. So these are the various types of dementia. And as I said, Alzheimer's is the most common. Then we come to breaking stigma. We've all seen that, culturally, India is very conservative. And because we are more family bound, tradition based, we have to actually help persons with dementia and their families to be inclusive in the community. So I think it's important that to break stigma, you need to be more aware of the disease, the disorder.
म्यूट
And
करना है
somebody's left the speaker on.
जब तक जमा
So
सुतलू
please close the volume, the audio of the mobile, please. Thank you. So I think it's important that, we have to spread the word so that there's less stigma and people are not taking persons with dementia as being affected mentally, saying that they're mad or they don't know how to behave, because we have to be very empathetic towards people who have been affected by this disorder, which is not an invited one, and it just comes. There's no etiology, so it's very difficult. So how do we break the stigma? We talk about dementia, we ask about dementia, we learn more about dementia, we change our attitudes for the better towards those living with dementia, we make them inclusive in our lives, we have empathy, we have genuine concern for the families and the caregivers, because they are the ones who bear the onus of looking after them. So I think it's very fair that we need to be very, very patient. And as we talk to the persons with dementia, we have to be very slow, loud, because they might be having a hearing loss also, slowly, because they cannot connect fastly spoken sentences. So short sentences is clear and loud, so they can actually hear, process in their brain, and then respond to you. So it is up to us that we have to evolve so that we can be understood by them more than them understanding us. So then we come to risk factors. So there are two under this group, which is modifiable and non-modifiable. So when we come to risk factors and awareness of modifiable, non-modifiable factors, we come to two main things. What we cannot change. And what we cannot change is our genetic family history, because that is what we come with, we live with. The only choice we have is moment we know that this is, genetically, we could be getting that disorder or disease, we have to look after ourselves and take precautions so we don't fall into it. Age, of course, we cannot change, because chronologically the calendar moves by the day and the month and the years, and that we cannot hold back. So the only thing is, even if your calendar age says 1, you can make it to half by lifestyle and discipline of doing things that should be done and staying away from what is not kosher. So then we come to more risk factors, that is modifiable. Now this is up to us. We cannot say, oh, I don't know how I've got this. We all know, we are very aware, internet is there. We have friends who are living with certain comorbidities, and we are having friends who we can relate with. So I think it's important that we pay very, keen attention to what are the modifiable factors. So now the WHO has come up with 14 modifiable factors. Earlier there were 10, then they became 12. Today it's 14, which includes inactivity, physical, smoking, alcohol, the air pollution that we are now being subject to more, head injury. That's why the government insists that you wear helmets when you go on the bike, drive safe, ride safe. And even now they make the riders, both of them on the bike, to wear, the covers. So also social low contact. I think we are all social animals, and we need to mix with people as often as we can. Maybe not, outside, maybe within the living complex, or a social group or a family group, and keep learning. I think the less education is one thing, but moment we try to learn a new language, new instrument, a song, or start writing, stories, they might be small stories for a grandchild who's never been told a story. So I think all education, whether it's in practical life or actually learning something as a, study, will help. Obesity, I think what we eat goes somewhere, it stops midway. So we all know that the girth of the body is increasing. So I think we have to be very careful of what we eat, so that we are conscious that we don't get obese and the BMI index stays normal. Also, hypertension. I think today's life is so fast and we are always wanting to keep with the Joneses that I think we are buying hypertension or at work, unnecessary worry. I think you perform as well as you can, the best you can, just overlook people talking. People are going to talk anyways, good or bad. When the times are good, they're going to talk good. When it's bad, they're going to talk otherwise. So I don't think we should let it affect. And there are a lot of ways where we can control this hypertension. Then also, cholesterol. I think that we have to keep on the watch. Like have every quarter you have a blood test done, so you're keeping pace with it. It's not that 1 year later you do a blood test and you find, oh my god, the levels have gone too high, the sugar is too high, and then suddenly try to control it. Diabetes, I think all as for India, I can say that the sweet tooth comes dime a dozen, with so many festivals, birthdays, anniversaries, any cause for celebration, cricket or whatever, there's always sweet around. So I think what you put in your mouth, you have to be careful, because what you eat is what you are. And eventually the blood runs in the system. So it's up to us what we eat, how much we eat. So eating anything, I mean, even if it's sweet, eat it, but not beyond a certain limit. Depression. Depression we can control, is modifiable, because it's up to us. If there's depression, seek counseling, help, try to find out what the cause is, talk to a friend, ventilate your emotions, but don't let it stay within, because nobody is going to pay the price of this depression but you. So take care of that. Very often we've had people who have, said, my father is not responding. I ask him, I shout, and, I tell them, when did you last have a hearing check or a vision, So I think ENT and ophthalmic checks have to be done at least once in 6 months for persons with dementia or the aging, because these can affect their function. And then we feel that they're not responding and we start shouting at them. So I think these modifiable factors is up to us, not only for ourselves, but also for persons who have been diagnosed with dementia. So next we come to is risk reduction, where you're going to take care of those modifiable factors. So first thing is healthcare. Have regular health checkups, eat the right thing, diet take care of. And you have to see that whatever you do is going to only build up a better you or a worse you. So what are these things? You have exercise, you have yoga, you have music and dance, movement, do crosswords, sleep well, sleep right, art and craft, and cognition games. I think that's the thing. Like the brain is one organ that's so far inside, you can't do anything. So, but to tone it up. So, like I call it a brain gym. Just as you go for a physical exercise and tai chi and uh, aerobics, you do the brain gym, where it means all the games that help you tone your thinking process. It could also be reading, it could also be writing, it could also be something to do with writing poems or creating music. So these are the things that would help reduce the risk of getting dementia. So then comes a diagnosis. See, symptoms go on increasing, or out of 14, there were 2 initially, then they become 4, 5, 6. So don't wait for it to be too long. But if, God forbid, there's a change of personality immediately, go to a doctor, because that's a telltale sign that dementia is already set in. So we come to diagnosis. Now, what happens? The first important thing is diagnosis. You must seek professional help, medically or therapeutically qualified. You must take the right advice, because sometimes you go to people who are not qualified and trained, you can go amiss on your treatment or medication as well as therapy. So here we come next is to the diagnosis, where what does it require? The diagnosis will be based on medical history, a cognitive exam, which psychologists would be doing, physical examination, then there are, of course, laboratory tests to be done. And if there is a need, you'll be asked to take an MRI. So then what happens a lot of times we've had is that people get diagnosed and they have been told it's too early, don't worry, you don't need to follow it up, just take my medicine and move on. Sometimes they've come to us and then I tell them, no, it's the right time, you've come for intervention. So why don't you start this, do it anywhere, not necessarily with us, do it anywhere, but try to follow the diagnosis right away with treatment. So we've had bad experiences of people coming maybe 6 months or a year later, and sometimes even much later. And the person has gone so far into dementia that, of course, I believe there's never say no, never say die. You can do it, try your best, and you can help the person who is living with dementia to at least sustain the level of cognition or improve upon the activities, and most importantly, curtail or slow down the process of dementia. I don't believe that there is a cure, but at least you can slow down the progress of the disease. So what is the best way to do? Medical treatment with therapies. I think it's important that we see that dementia has to be treated on a integrative approach basis. Medicines do their job, that's great. That is the to the body. Therapies help the mind and the soul and the family who has the member living with dementia, and also the caregiver who's actually hands-on looking after the person with dementia. So next we come to is rehabilitation. Rehabilitation requires a team, a multidisciplinary team, which has a neurologist, a psychiatrist, a physiatrist, a rehabilitation physician, orthotist, then you have a speech and language therapist, a physiotherapist, occupational therapist, psychologist, social worker. And I think the most important person who should be on the multidisciplinary team is a family member. Why? Because a family member is the one who's going to live with the person with dementia at home. And if there's a caregiver, not a primary or caregiver, then even the caregiver, because what happens is whoever's looking after the direct care of the person with dementia has to be in the know of things. They must know, the medical therapeutic team must know what is happening, how they can evolve, how can they modify the treatment, how can they modify the therapies per session. So I think a family member or a caregiver is important to be present over there. So then we come to care. Now, care is a big challenge. We all know that even forget the medical and therapeutic care for persons with illness and neuro orders disorders. I think care even is a simple. If you want to change a housemaid or you want a housemaid, how difficult is it? It is very difficult. Likewise, getting a caregiver and a trained caregiver is very, very difficult. And I think it's important that we see care from a different point of view. So care skills. How many of, see, Indians, by and large, we try to adjust in the family home. One, because you can be with the family with dementia closer, you can strengthen the bonds, and you can probably handle the person because you know the person well enough. But when you have to hire a caregiver and you have to find a good one, you need to find somebody who has been trained by an established, standardized, and a recognized training group. Because unless you have skilled trainers, caregivers, it's not going to help. And this comes for caregivers either if they are primary or family caregiver. Primary could also mean a neighbor, a friend, a relative, and a skilled trained professional, which, there are bureaus, there are people who hire them directly from other professional, semi-professional places. So these should be very, very keenly seen because they are going to handle the person with dementia who has a lot of mood swings and very unpredictable. So they should have all the qualities of a caregiver to have, like, they should be patient, they should be understanding, compassionate, They should be able to mix with the family. Interpersonal skills are very important. They should also be in a position to take a decision in times of emergencies. They should have basic first aid knowledge. So, God forbid you have to wait for something or somebody to come. They have taken the most immediate decision. And here is where the family takes a major role, because they have to decide who to choose, who to hire, and monitor the person till they actually are convinced, or they believe that they can look after their family with dementia well. Then we see that there's the persons with dementia care is not that easy. Okay. It's, it's something where people have to face the truth, because it's not easy that, suddenly you're decided that, your family member has dementia, when a person had lived so well with, normal life, a successful business career, or a career, professional career. And then you find that, the person has actually gone suddenly into this disorder, which has no warning. I call it a thief that steals into the house of the body and destroys the vault of the mental being. So I think it's a very, very challenging thing for not only the person who has dementia, because they cannot understand what is what, and the family, because they are the ones who know, but they can't do a thing except give good care. And the caregivers, God forbid, they are not just there for the sake of the job and money. The caregiver is emotionally also attached to the person with dementia. So we have to see that not only do we care for the person with dementia, but we also support the caregiver, the person with dementia, and also the family. As a community, I think we should come together to give both care and support, to ease the onus and the challenge, and meet the challenge of looking after somebody with dementia. So care is beyond disease. I believe a disease can be cared by medicine, cured by medicine, but care is something that needs a lot of emotional attachment, a commitment, something where you know that the person is going to be looked after well, and personalized treatment, a person to person care. So the bond is established and the person feels that they are wanted. So I say it's a care beyond disease. Then we have to give hope. Nothing is the end of the world. Hope is something where you can offer the best you can. You offer of yourself, because we are running a race against time, not only normally, but more so with persons with health challenges and those with dementia. So I think we need to get together, join hands, and make life better together, not only for others, but for ourselves. I believe the more you give, is what you get back in manifold. So give unconditionally. Let's extend ourselves. I think it's important that, since some diseases come untold all of a sudden, with all the pollution outside, and lifestyle being irregular, I think, we have to empathize. We have to be for others, because who knows who would require whom. So I think we have to give hope, support, and get together. So here is our daycare. It's called Universe of Memory Smriti Vishwam, where we have elderly, those who diagnosed with dementia come. And what we do is, we not only give a, a time of their lives that they look forward to come next to, but we create an impact that is memorable, and not only for the person with dementia, because once they go home at the end of the day, the caregivers feel that no, they've had a change. They also feel that they have given their best at the daycare center. They're tired out, and they know that they will need to have a relaxation at once they reach home, because they are not allowed to rest in the afternoon. And we give them all kinds of things. They've had, the lady at the far right used to be a seamstress. She used to take classes, so we got the sewing machine for her, and she used to have some person stand as a student, and she would teach how to take drafting and how to take measurements, how to stitch. So it was a fun thing. We had at the bottom left, we had an artist who used to take workshops of art, and we did the best for whatever we did for them. We celebrate birthdays, we celebrate anniversaries, we celebrate grandchildren's birthdays, and what have you. And all this because we want to give them a quality of life and well-being and a social life that they once enjoyed before they were diagnosed. So they don't really miss out on what they did once upon a time. In fact, they're happy that they can do all the things with fun, and we see that they have a great day before they go ahead. So the main thing is when they come to the center, our main focus is to sustain cognition and improve the quality of life and well-being, not just for the person with dementia, but their families and caregivers. Because these 5-6 hours are the time where they can relax, they can do their own thing. It's a me time for them. And for, thank God, our family with dementia have a blast at the center, challenging at times, but the challenging times are well worth it because they've had a good time, and looking at them have a good time, we've had good one too. So I love this thing where Herman Melville says we cannot live only for ourselves. 1,000 fibers connect us with our fellow men, and among those fibers, as sympathetic threads, our actions run as causes and they come back to us as effects. I think it's very true in real life, because unless we work together and unless we think of others, put ourselves after the one in front of us, we can only then make it inclusive and a dementia-friendly nation to the delight of the families and caregivers, because we are going to make them inclusive and not be looked down upon due to social, cultural stigma. So this is a thing they always say, care for me, do you love me, will you leave me? So these are the questions that they often ask us. So I say that, let's be there because they're alive inside, they feel, they're hearing, maybe they cannot express, but we have to be very careful of what we talk in front of them. So never, I would say, refrain from talking about them in front of them, because they might be crying within and you'll never know. And we are taking away their quality of life as we talk about them, against them, in front of them. So this is a flower I love. It says, it's a forget-me-not. And I think it's important that we remember those who cannot remember. And at the end of this presentation, we have come to the end of the Dementia Circle. And I hope, things are going to be taken well. And it's time now to say thank you to be present for this presentation. And remember those who cannot remember, as I say. And our little Ellie says, don't forget, don't forget. So I'm ready to take questions that you shoot out. And thank you once again, HSSC and the audience.
Thank you so much, ma'am, for such an insightful topic, and your all the things what you have shared is really insightful, and we have really learned a lot at the personal level. Also, we have learned a lot from you. Thank you so much.
Thank
If
you.
anyone have any questions from ma'am, you could put your questions on the chat box. We can then start addressing the questions here.
I would like to
Thank you.
thank
Yeah.
ma'am,
Yeah.
Ms. Amla
Yeah.
Samanta.
Yeah.
So I'd like to personally thank her for a very insightful.
Thank you, Amla. Thank you, Shrutakirti, Madhumita, and Nandini. Yeah. Thank you, Neeraj. Thank you. Yeah, somebody's asked for the games. Any game that hones the mind. It's like a knife that you're sharpening, and you want to, it's blunt. You want to sharpen it. So what do? You can't put your hand in the head and take out the brain and sharpen, right? So the oiling for the brain is cognitive games, which would be crossword, Scrabble, chess, depending on what stage of dementia they are in. So I think it's important to first get the screening done to find out which stage they're at. And therapy, like I design modules according to the stages of dementia. So I think you have to be very choosy in what games you play. But basically, mental games, if you want something like giving focus to the person because they get distracted, then you take something like carom. You want them to think better, give them maths to do basic maths. You can also ask them to do some thing where they have to concentrate a lot more, like small fine things that they have to sieve and sift. That could also help. So somebody has asked, thank you, Arogya Gramin Healthcare. Thank you, Lily. Thank you, Nikhil. Thank you, Pranav. I don't know who the Xiaomi person is. Yeah, you've asked where can I test whether I have. Okay, God forbid you don't have. You're welcome to come to us for the screening, and we'll get it done for you. The address was at the thing, and HSSC can give you the details if you contact them. So okay. Lakshmi, thank you for coming in and listening. Nina, thank you. Nina has joined in from Prague. I'm sorry I've kept you awake, but thank you for coming in. Okay. So any more questions?
Meanwhile, if they ask some questions, we have some questions for you.
Okay.
If you could answer. Since you are successfully operating a dementia daycare in Mumbai, ma'am, so
Yeah.
how do these services help and how it could be scaled up across?
Okay. See, daycare is basically, I call it a respite time for the caregiver and the family. The onus of care for a family and a loved one with dementia is very, very challenging. Okay. It kinds of burns you out with the care given, and that person has nowhere to go, because when the caregiver takes a job or doing it for the family, it's at the sacrifice of a career or choice of personal life. I know of cases where a lot of them have remained single, or they have not taken up a job because their commitment was their family. So, and they were focused on it, which is bless them, let them be healthy and happy, and but it calls for a lot. And what are the things they've given up because they couldn't leave them, because they were immobile or whatever the reason? So the daycare came as a stopgap arrangement for families having a member with dementia, and they would require that time to ventilate their emotion. Maybe go for a movie with a friend, maybe have coffee at Starbucks with anywhere. Just go out or just go window shopping by oneself. And a caregiver also needs the break, because by and large, what happens is a caregiver also looks after a lot of other things in the household, because she's either settled in as she started as a caregiver, but now she's like a member of the family. She's well fed, she's well looked after. And then what happens is that she is wanting that break. So we say, okay, let her come. If she's very frail, the person with dementia, we say, you come, but at least we know that you're available, but don't go too far. So each one needs a break. And main thing is, our family with dementia has a ball coming to the center, because they can do what they like, they can dance and move as they like, they can shout also as they like, but they have a good time, we have a great time. And I think they also need a break from the family, who always tell me, don't do this, do that, do this, do that. So that's how it helps. And we are very proud because we are ISO certified, and we are very privileged to look after our family with dementia. I'll just in the meantime run through. See the thank you for the compliments of the presentation, and I've enjoyed it as much making them, because I've identified what I go through looking after our family of with dementia in the daycare center. But we do have it again. We have people coming from very far suburbs also. We do home care support. We have events, we take them out, we celebrate festivals. So we give them a normal life. I suggest you call us, ma'am, because it's just the phone number. I mean, model and the thing. So you'll have to call. Shalini, thank you so much. And Mr. Bablu Das, thank you too. Neha, thank you. And that's about it. Any other questions you have had in the chat sent?
Not in the chat, I think so. Everybody has just given the lots of appreciation and thanks to you. And we also give you our heartfelt thanks to you, ma'am, from the bottom of our heart. Thank you so much for taking
Thank you, Neha.
this very important session. And
Thank you.
this is a very need of the hour. We don't really understand when the dementia is there and when we have to really go and seek advice for the same.
Yes.
This is very important to be identified as early as possible. Thank you so much, ma'am.
Thank you, Narayan, for that dissertation of gratitude and compliment. And before I sign out, I want to wish each of you good health. See that you outrun the thief of dementia. Stay safe. Be happy. May you have miles of smiles in your life and divine grace and blessing without which we don't exist. Yeah. Love you all. Thank you. Thank you, Mr. Bandari. Thank you. Yeah.
Thank you, all of you. And we will meet you with our 19th series in the month of December. Thank you.
Thank you. Thank you, Asha. Thank you, Nikhil and Neelu. Thank you. And, you can always take the contact details from Dr. Neha, and we're always there to help unconditionally. So please do get in touch, and it'll be a privilege to, answer you. Is it Smita Gandhi over there? Ma'am, are you Smita? She's not on it's a mute. Lakshmi, thanks for leaving taking time. She's a professor at the university in Kasargod. Thank you for joining. And she's an excellent professor of social work. I've done a lot of, lectures with her. Very warm, and thank you for coming. Thank you. Yeah. Thank you.